Welcome to today's lecture. We are going to be talking about the management and classification of mental disorders. You understand? You must understand because in the exams they might ask you to say explain the classification of mental illness. Whichever classification you have read in books, I don't care. You understand? Yeah? Because these lectures are not designed for you to make a clinical diagnosis or maybe to treat a patient. These lectures are designed for students who want to easily pass mental health. So categorically, mental disorders are classified into two, as the psychosis and the neurosis. So in psychosis is where the symptoms are so severe such that the person loses in touch with reality. While in neurosis, the symptoms are less severe and the reality is intact. Then psychosis is further graded as the organic psychosis and functional psychosis. Under organic psychosis, we can say these are a group of mental disorders which has got a demonstrable physical cause. And under functional psychosis, these are a group of mental disorders which have no demonstrable physical cause. Then let's give examples of the group of mental disorders which fall under organic psychosis. We have got dementia, which is a chronic brain syndrome. We have delirium, which is acute brain syndrome, and we also have got HIV-induced psychosis. Then also under functional psychosis, we have got schizophrenia and its types, and we also have got mood disorders. And under mood disorders, we have got mania and depression. Under neurosis, we can also give examples of conditions which fall under neurosis. We have got anxiety disorders, we have got sexual disorders, we have got sleeping disorders, we have got somatoform disorders. Yes, so you must know that one. So, after looking at the classification of mental disorders, because for the students, this must be a very basic information where in the exams you are asked to classify um, mental disorders. This must be a very basic student because or a very basic information because they can ask you in the exams to say explain the classification of mental disorders, which sometimes can attract 25 marks. So, after looking at the classification of mental disorders, let us look at the difference between the differences between psychosis and neurosis. Also, this must be a very basic information to students because in the exams they can ask you to say state the differences between psychosis and neurosis. So we say when the person is experiencing psychosis, they lose in touch with reality. While when the person has got a neurotic disorder, reality in touch with reality is intact. That is one different. So we are saying that when the person is experiencing the symptoms of psychosis, such as positive symptoms as well as negative symptoms, they lose in touch with reality. That means they become in their own world. Meanwhile, when the person is experiencing neurotic symptoms, in touch with reality is intact. That is one difference. Number two, psychosis is mainly accompanied by delusions and hallucinations, while in neurosis, delusions and hallucinations are absent. Then also in psychosis, the patient lacks insight. That means that the patient is not aware what is he or she is suffering from, while in neurosis, the insight is present. The patient knows why they are seeking a particular psychiatric interventions. Then also in psychosis, mainly when we are treating psychosis, we use both drugs and counseling, or we use both pharmacotherapy as well as psychotherapy. While when the person is experiencing psychosis, we may use psychotherapy only. Then also, when the person is experiencing psychosis, mainly they need an admission because they are a danger to the community. While when the person is experiencing neurosis, they may be treated as OPD. You understand? Yes. So you must understand this. The classification of mental disorders as well as the difference between psychosis and neurosis. These must be very basic information to students. Then from there now, we are going to relate ourselves to conditions. So we are going